athlete. I remember, so I'm a current sports medicine fellow physician at UCLA. And when I was seeing one of the athletes, like one of my patients, and talking to them about, different stressors that they were facing, and I gave them a couple of tools on how to kind of reframe their cognitions or how they think about something, and around mindfulness, different small breathing exercises they can do. Because initially I was like, oh, well, we have great therapy services. There's someone you can meet with. And they're like, oh, I just don't have time. I don't have time. And then I chatted and gave them a couple of strategies. And they were like, that was perfect. Like, I just needed a couple of things that I can hold on to and work into my day.
Yeah.
And I think that was so powerful to me, because I was like, that's true. Like, not everyone has the time, access, or resources to sit and talk to a therapist for an hour.
Yeah.
And I think that puts an onus on us as educators, as physicians, as people in the working with youth, to think about how can we shape this environment to teach these skills and to incorporate skills around emotional intelligence, around mindfulness, around self-awareness of your thoughts and not identifying with negative thoughts, and how there are ways to teach these things, just like, everyone has to learn the Pythagorean theorem, at some point. You learn that mitochondria is a powerhouse of the cell. Like, there's certain things that everyone learns. Like, why can't we learn those things around our mental health that will carry us on forever and lead to our overall development and our growth? And I think it works so well in an athletic space, because you need so many of those skills to manage your emotional arousal in a game. And so I feel like it's an easier sell to teams, to coaches, to say, hey, these are skills that your athletes can use to keep themselves balanced during a tense situation, to keep themselves mindful, and to keep them calm when, the ball is coming to them and there's 3 seconds left on the clock and they have to make this shot, or they're not making it to the championship. And again, those are the skills that they will carry forward truly for the rest of their
forever.
lives.
Absolutely. Yeah. We've been talking to, people in academics. We also have psychiatrists, psychotherapists, therapists on our team, and they're starting to use this as tools for their patients as well. But more importantly, making this something that starts at making the Band Bond initiative, the conversation, emotional intelligence conversation that starts at elementary school, and then to be able to achieve a certain goal, as you graduate to middle school. And by the time you're done with middle school, you already have these tools, because everything's about practice. Practice makes perfect, but that's ingrained in you. Yeah. It's like, what do they say about Kumon? They make you do math over and over and over again, and then automatically your brain just absorbs it. But teaching you to express your emotions, to focus, to come back to something if you haven't completed it, and make sure you get it done. It's the little things. And then understanding people around you, that's kindness, that's gratitude. There are so many things that come with it.
Exactly. And it's so funny, because I was really focusing on college athlete mental health as, a college student who dealt with mental health issues. And as I was working in that space with Princeton Athletics, a lot of folks say, we really need kids coming to college already knowing and having these skills. Yes. I'm like, okay, great. Let's focus on high school. And while I was getting a master's in public health, I worked with a school district to build a mental health program and create a curricula around mental health, and was trying to incorporate these things into the school day. And the feedback I was getting from administrators was like, we really need the kids coming to high school with these skills. I was like, okay, go to middle school and even
do
younger.
Something about it.
Exactly. Because there's this idea, and it's the same concept in medicine and in public health, that, rather than dealing with a disease or disease process once it's already developed and once it's there, why not prevent it from developing in the first place? And it's the same concept, and what I really hope to help have an impact on in my career for both physical and mental health, rather than, doing all of these things that are going to lead to disease, to injury, to mental distress, all these negative thought patterns, all of these negative ways of seeing, the world and the situations and our bodies and our identities. Why can't we start off, 7, 8, 9 years old,
absolutely,
already having these skills to be able to build ourselves up, to be able to express ourselves, to be able to move through challenging situations, rather than just kind of stumbling through it and developing negative coping mechanisms along the way and just gritting and bearing it and shutting down our emotions and then dealing with what comes out of that 10, 15, 20 years